Buncombe County, North Carolina has an abundance of natural beauty. One reason tourists flock here. Another is the city of Asheville, known for its restaurants, artists, and comfortable lifestyle. But not everyone in Buncombe is thriving, and Health Director Gibby Harris and other community partners have been leading the charge to fix that.
We have a very engaged and involved community, so we have lots of people involved in many activities that could improve health in our community. We do have health issues in this community. Obesity is an issue, as it is in many places in the country. We have high rates of hypertension, diabetes compared to the rest of the state and the rest of the country. And the thing that really drove this is a community interest in being the healthiest community in this country. The center at Emma Elementary School provides crisis support for families of children who live in that area. That elementary school has the highest free and reduced lunch rates in the county. So we know we have children who, when they're away from school, might very well go hungry. The center provides a food pantry where parents can come and get a food box. The focus is not on just dealing with a crisis, but also helping them get out of the crisis and then moving them into jobs and housing that will meet their needs. The Verner Center for Early Learning created Rainbow in My Tummy several years ago as a way of improving the food and nutritional setting for the children that are part of that center. They've engaged local farmers, they bring in local foods, they want to present the children with lots of variety, lots of color. They want to make eating fun for children. The Pisgah View apartment complex is a HUD housing project that provides housing for low-income individuals, many of whom are families. There have been quite a few efforts there to help these families realize sustainability. There's the Learning Center that's available to the children that live in that complex. It provides a safe after-school environment for them to get their homework done, to receive tutoring. In addition to that, we have a community navigator that serves that community.
But for her to have to go through all of that to access consistent medical services.
The navigators were created to improve access and knowledge and understanding of the availability of services through Health and Human Services.
When we come into their lives, we bring a sense of hope. We can make a difference, and 9 out of 10 times we do, but it's that difference that says, I can walk with you this far.
We have Tupelo Honey, who has specifically taken on and adopted the Shiloh community to help them around food issues, but also just to build their community as a partner. One of the things that they've done is help them build their capacity around their community garden. Tupelo Honey is also building an amphitheater in that community that provides a place for the community to come together. We have an incredible number of farmers markets, and we have been successful in getting many of those farmers to a place where they can accept EBT, the food assistance that people receive. So you've got somebody with an EBT card that can take it just as if it was their debit card to the farmer's market and get that fresh head of broccoli or that eggplant or those strawberries.
Thank you. You too.
Our community's vision for a culture of health means that everyone is healthy and active, eats well, avoids tobacco, that we have a system of health care that is not strapped by people who are constantly in crisis. A community that's focused on prevention and is always looking to the future. And I believe it is within reach.